have it for later. So the, can you guys all see my screen?
Yeah.
Okay. So as far as the muscles go, I don't know if you've had a chance to look in Canvas at what's available for you to study from, but I do have a, an activity or an exercise that's due for a grade on there, posted on there. And so you'll have that to do to help you learn the muscles. So there are different, your objectives, you're going to be able to pronounce the key terms. There's a lot fewer terms to learn in this chapter than there have been in the past. They're listed in the front and there's only about 6 of them. So the key terms to know are the origin and insertion. The origin is the end of the muscle attached to the least movable structure, and the insertion is the end of the muscle attached to the more movable. So we'll just keep reviewing that. Locate and identify the muscles of the head and neck on a diagram, skull, and patient. Describe the origin, insertion, action, and innervation of each muscle of the head and neck. Discuss the processes of mastication, speech, and swallowing with regard to anatomic considerations involving the muscles. Discuss the pathology associated with the muscles of the head and neck. Correctly complete the review questions and activities, and integrate an understanding of the muscles of the head and neck into the clinical dental practice. So there's quite a few muscles for you to know here. Okay, so the muscular system. The muscular system contains skeletal, smooth, and cardiac muscle tissue. It shortens and lengthens under neural control. So what that means basically is that your nerves tell your muscles what to do. So if you have ever known anyone to have like nerve damage, think about a person who has a stroke. So what happened is their brain, they got some damage from the bleeding in the brain, and it has damaged the nerves. And normally there's like one side of their body that they can't move. I don't know, have any of you seen people or are familiar with people that have had strokes? Anybody? Have anybody experienced one? So there's damage to one side of the brain, and the neurons cross each other. So if you have damage to the left side, it's going to affect your right side and vice versa. Damage on the right side of the brain affects the left side. What it damages, though, is not the muscles, it damages the nerves. The nerves tell your muscles what to do. So you've got this whole side of your body is full of nerves and muscles. And the reason that they can't move their arm or their leg or their mouth that droops or around their eye that droops is because the nerves have been damaged. And they can't signal the muscles to do something. So the origin is the end of the muscle attachment of least movement. So in your case, in the head and neck, the origin is going to usually be someplace on the skull or the neck. And the insertion is the end of the muscle attachment that has the most movement. So in other words, it's going from the origin, which is like a more solid standpoint, to the area of insertion. And the insertion area is what's going to move. And I'll explain that a little bit when we start looking at the different muscles. Let's see. So the muscles, there are 6 main groups according to their function. You've got your cervical, your facial expression. Your facial expression muscles give you the ability to smile and frown and wrinkle your forehead, things like that. Mastication gives you, those muscles are for chewing. And then your hyoid bone, hyoid muscles and pharynx, particularly your hyoid, helps you with swallowing. And then your tongue, obviously your tongue has a lot of muscles in it to do various things, anywhere from sticking it out and retracting it to assisting in pushing food down your throat after you've chewed it. And then your pharynx is kind of in your throat area. So your cervical muscle group, there's two of them. Your sternocleidomastoid, which we've talked about many times. It's the large strap-like muscle in your neck area here that you palpate when you're doing your extraoral exam. And then your trapezius muscle, which is this one that's right across the top of the neck. It's a rather large, kind of fan-shaped muscle that comes off of your neck. There's a picture on page 94 that shows it really well. Your sternocleidomastoid muscle, it says, is very superficial, meaning it sits really close to the top or the surface of the skin. They're paired, so there's two of them. And they're the ones that divide the neck into the anterior and posterior triangles. So we talked about this when we did surface anatomy. It runs down the kind of the center of your neck and divides it into anterior and posterior triangles. And its function, the function is to move your head and neck. So there's one on each side because they're paired and they function to move your head and your neck. Their origin is the sternum and the clavicle, and their insertion is the mastoid process. Sternocleidomastoid, sternum, clavicle, mastoid. So it's kind of like, just like it sounds, sternum, clavicle, mastoid. Do we remember where the mastoid process is? Let me grab a skull and I will show you on the skull again. The mastoid process, hopefully you can see this, is this kind of porous, bigger bone right here. And that's one of the areas of insertion. So its origin is the sternum and the sternum and the clavicle. So down in here, and it inserts up here, which is where the mastoid process is, right here. And so when you're palpating, you're going like this down the muscle, right? And so that's what you're feeling. And its innervation is the 11th or accessory nerve. When we get to chapter 8 and we study the nerves, we'll kind of reinforce this whole concept. As far as studying and quiz purposes and just learning what it is, when I have a quiz question or a test question, I might say, you know, the origin is the sternum and clavicle, the insertion is the mastoid process, and the muscle functions to move the head and neck. So I would give you both pieces of information. I'm not going to just say which muscle inserts in the mastoid process, even though you should probably be able to answer that. Now, I can't promise you that that's not going to be the way boards is going to list a question, but for the purpose of our learning here, combine them together. So know the origin, insertion, the as far as the nerve and blood supply, kind of pay attention to those, because when we get to blood vessels and nerves, chapter 6 and chapter 8, you'll have to memorize those. But for the purpose of the quiz for chapter 4, you do not have to memorize the nerves and the blood vessels. For now, let's just memorize origins, insertions, and what their function is. Your trapezius is paired and it covers the lateral and posterior surface of the neck. So you can see on this slide number 6, there's a picture of the trapezius. It kind of fans out away from the center of the spinal column and goes out towards your shoulders. Its function is to lift the clavicle and scapula. So in other words, shrug your shoulders. The trapezius is responsible for doing this. Everybody do this with your shoulders, and you can feel your trapezius muscles moving. Its origin is the occipital bone. So if you look at this picture right here, can you see the cursor?
Yeah, I can see it.
Okay, so its origin you can see is right here at the occipital bone. Here's the occipital bone right here. And again, on the skull, here's the occipital bone. It's this rounded bone area right here. And then its insertion is in the clavicle, so right here in the neck area. And the innervation is the 11th or accessory nerve. So the muscles of facial expression, we have a lot of muscles of facial expression. If you have your textbook handy, on page 96, there's a good picture from the side view of the muscles. You have those little cards in the back of the book. And on page 95, there's an anterior view of the muscles. So the muscles of facial expression all have different functions, different insertions, different origins. The best way, usually everybody knows the muscles inside out and backwards by the time we're done with this class because they're pretty easy patterned. So when you're looking at page 95, if it says orbicularis, that means it orbits or goes around something. So like your orbicularis oculi goes around your eye. Orbicularis oris circles your mouth. So anytime it's like orbicularis, it's going to mean orbits or goes around. Then you've got anything with the term levator. Anything, levitate means to lift up. So anytime a muscle is called levator something, it's going to be lifting something up. And then your other group of muscles have the word depressor. Think of depress being really down. Depressing pushes something down. So any of the muscles of facial expression that have depressor means they're pulling something down, like to frown. So once you kind of look at those, eliminate all of those muscles that sound like their names, there's only a few other ones that you would have to know. Like the mentalis muscle, we know that this is the mental region of our face. So we know the mentalis muscle is going to be somewhere in this region and it's going to do something in this region. Another one, the platysma is kind of one of its own. So you'll just have to kind of look at that. And that one runs right along here in this area. In your handouts and stuff that's posted on Canvas, there are several different handouts to help you memorize the origins, insertions, etc. It will also tell you what the different muscles do, whether they raise the corners of the mouth to form a smile, whether they depress the corners of the mouth to cause a frown. So they all have different functions. And this is what they look like. So we will need to know what they do, their origin and insertion. And again, when I have a quiz question or even on the midterm or final, there's going to be two pieces of information. I might say its origin is this and it does this. So what it does is almost always going to be part of the equation. So when you're reading these and studying, study really hard what they do. And like I said, you can pretty much figure out what they do. Like the depressor on the picture on the right, the second one from the bottom, depressor anguli oris. So we know that depressor means it's going to pull something down. Think of anguli as the angles of the mouth. So they pull the angles of the mouth down. Oris is the mouth, oculi is the eye. Labii would be the lips. So there's just basic terminology on those. You might jot those down so that you can kind of, when you're looking this over, you can keep refreshing yourself. If it's talking about the depressor labii inferioris, you can know that one just based off of its name. Depressor is going to pull something down. Labii is going to be in the lip area. Inferioris, think of inferior, it's going to be below the lip. So even without memorizing anything about it, you can break down the word and figure out exactly where it is. Zygomaticus minor and major. I mean, just by the fact that they're zygomaticus would tell you they're somewhere up in the zygomatic area here. They're kind of different. Major you would think of would be on top and bigger. Minor would be smaller or lesser. The minor's actually on top of or above the major in this case, but there's just those two. So you will need to know the muscles of facial expression. Muscles of mastication. There are 4 muscles of mastication. So for all your chewing and that kind of thing, they're done. It's done with 4 muscles: the masseter, the temporalis, the medial pterygoid, and the lateral pterygoid. So just by their names, medial pterygoid is going to be more in, lateral is going to be out further. The lateral pterygoid muscles are the ones that are usually involved in TMJ disorders. We're going to talk about TMJ today too. They are paired muscles, so there's going to be one on each side. They move the mandible, so that's their only function, is they move the mandible somehow, whether it's depression or opening, elevation, closing, protrusion, retraction, and then lateral deviation. So when you're doing your intra or extraoral exam and you put your fingers on the TMJ and you move your jaw side to side, that's called lateral deviation. How does the jaw shift from side to side? Their origin depends on the bone, and then their insertion is going to always be somewhere on the mandible because their purpose for mastication is to move the mandible. And they are innervated by the 5th cranial or trigeminal nerve. The facial expression muscles are innervated by the 7th cranial or facial nerve. The muscles of mastication are by the 5th cranial or trigeminal nerve. Put those 2 on your list to know. The 7th cranial is what innervates your muscles of facial expression. Your 5th cranial or trigeminal innervates your muscles of mastication. And these are a picture of your muscles of mastication. Your masseter, as you can see, is this big one right that comes down here. And it's a big, strong muscle, aids in chewing. Your temporalis is right up in your temple area. It sits in the temporal fossa. Remember, we said the temporal fossa is right here, and your temporalis muscle sits right in that fossa. And then your lateral and medial pterygoid muscles attach to the pterygoid plates. And if you remember correctly on the skull, we had your lateral pterygoid plate and your medial pterygoid plate. So remember the 2 pterygoid plates. And then this little hamulus that comes off the medial pterygoid plate right here is where one of the muscles is going to attach. So your masseter muscle, it's the most superficial, meaning it's closest to the surface of the skin. It's one of the strongest muscles, and it's anterior to or in front of the parotid gland. So if you look at this picture on page or slide 11, you can see right here, this little yellow thing right here, that's your parotid gland. That's one of your salivary glands. It's the one that opens up in the parotid papilla in your mouth. And we talked about the parotid papilla when we did your surface anatomy. Your parotid papilla is just inside your upper second molar. Its function is elevating the mandible and raising the lower jaw. So everybody put your hands right on the side of your face and elevate your mandible. In other words, lift your lower jaw. And you can kind of feel that muscle moving a little bit. So when you think about your chewing, you're pulling, you're elevating your mandible. And its origin is the zygomatic arch, so it connects to your cheekbone, your zygomatic arch, and it inserts on the lateral surface of the mandible and the ramus. So lateral surface of the mandible and ramus, so right here. This is its insertion, and you can imagine it's inserted there, and it's going to move the mandible like this. Your temporalis muscle, it elevates or closes the jaw. So they work together. And then its origin is the temporal fossa. So temporalis muscle sits right here in the fossa. And then its insertion is the coronoid process of the mandible. And so you can kind of see by that picture, it inserts over here. So you've got the masseter, and now you've got your temporalis. And both of them, they work together to elevate the mandible. Then you've got your medial and lateral pterygoid muscles. So this picture shows you where the medial and lateral pterygoid muscles are located. So the function of the medial is to elevate or raise or close the lower jaw. So now you've got the three muscles working together to close the jaw. Its origin is the pterygoid fossa. So remember, we flipped the skull up. There's the pterygoid fossa. And on the medial surface of the lateral pterygoid plate. So find your lateral pterygoid plate, and the medial surface would be the side that's closest to the midline. So it would be right here is where its origin is. And its insertion is the medial surface angle of the mandible. So the medial surface angle of the mandible, so right here. And then your lateral pterygoid muscle has two heads, or two parts to it, a superior and an inferior. So the superior and inferior are going to lie up above and below each other like this. Their function is to open the lower mandible, protrude it, and laterally deviate it. So when we have our fingers here on the side of a patient's head and we say shift your lower jaw from side to side, lateral deviation, that's the lateral pterygoid muscle that's causing it to do the lateral deviation back and forth. It's nice that they named them kind of like they should, lateral deviation, lateral pterygoid. Its origin is the superior head of the greater wing of the sphenoid. The superior is the head of the greater, superior head is the greater wing of the sphenoid. So the sphenoid bone, let me grab the colored skull so we can see it better. The sphenoid bone is the red one on the inside, right here. So it's going to attach to the greater I'm really having a hard time today, to the greater wing, which is the one below. The lesser wing is up toward the top. And then it's also going to, the inferior head is going to be attached to the lateral pterygoid plate, which is this one right here. And we've already looked at the lateral pterygoid plate. And then together, they're going to come together and they're going to insert into the mandibular condyle. So they're going to insert into the mandibular condyle. And that's the sliding back and forth that you're going to get. Anybody have any questions? Okay. Your hyoid muscles. Anybody? No? Okay, your hyoid muscles are paired. So you've got muscle on each side, superficial neck. So what that means is they're in the neck and they're close to the surface of the skin. Their function is to assist with chewing and swallowing. Their origin depends on the muscle, and they all insert into the hyoid bone. So if you remember the hyoid bone, it's that little horseshoe-shaped bone that's right about here, that's surrounded by the thyroid cartilage and thyroid gland. All of your hyoid muscles are going to insert into that hyoid bone. So it's a very active, very important little bone that's suspended right here in the neck. You've got suprahyoid and infrahyoid. Suprahyoid muscles are going to be above the hyoid bone, or supra, and infrahyoid are going to be below the hyoid bone. So the hyoid bone sits right about in the middle. So anything that's a suprahyoid is going to go up this way. Any of the infras are going to go down this way. but they're all going to insert into the hyoid bone. Your suprahyoid muscles, you've got 4 of them. The digastric is for chewing and swallowing. Its origin is the mastoid notch, so it's going to be right here. And its insertion is going to be the hyoid bone, because they're all going to insert into the hyoid bone. So it's going to run from here down to the hyoid bone. The digastric is innervated by the combination of the 5th or trigeminal and the 7th. So it combines both of those. The mylohyoid muscle is underneath your chin area here. And its origin is the mylohyoid line on the medial surface of the mandible. So if you remember looking at your mandible, you had this mylohyoid line. And you can see in that picture, it's attached to this, it's actually sitting like this in the picture, so it's attached to the mylohyoid line. And it's going to insert into the hyoid bone, so it's going to run kind of this way to the hyoid bone. And its innervation is the mandibular nerve branch of the 5th or trigeminal nerve. Just know the 5th trigeminal nerve right now. Don't worry about the mandibular branch. The mylohyoid muscle and mylohyoid nerve are kind of important when you're giving anesthetic, but we won't worry about that right now. The stylohyoid. Now you're going to notice they're all going to start to sound the same. There's 8 of them, and most of them end in hyoid, and so they all start sounding the same. So this is where your mnemonics might come in handy for studying. So list your 4 supras and come up with a phrase for that. List your 4 infras, come up with a phrase for that. Or you can list all 8 in an order, but just make sure you know like your top 4 are supra, your bottom 4 are infra. But this is where mnemonics come in very handy. So your stylohyoid are for chewing and swallowing as well. Their origin is the styloid process. So remember the styloid process is this little spiky thing right here. And they, of course, insert into the hyoid bone. And so you can see by that picture, they kind of run like this. And then you've got your geniohyoid, which also functions for chewing and swallowing. Its origin is the genial tubercles. So we remember on the mandible, the genial tubercles are right down here below your lower incisors. On a radiograph, they're radiopaque or white colored. And then their insertion, of course, is going to be the hyoid bone as well. Your infrahyoid muscles, you've got your thyrohyoid, which raises the thyroid cartilage and larynx. So this is where it helps with swallowing. Its origin is the thyroid cartilage, and its insertion, of course, the hyoid bone. And again, I'm not too worried about you memorizing all the nerves right now. Know the 7th and the 5th. We'll get to all the rest of them when we cover the nerves. The omohyoid has 2 bellies, inferior and superior, so they're going to run superior, inferior. It depresses the hyoid bone or pushes the hyoid bone down, depresses. Its origin is the scapula. And then the superior belly of the hyoid, so let's look at the picture. Oh gosh. So you can see the omohyoid, its insertion is going to be the hyoid bone. For the superior, the inferior is going to insert into the superior. So they're going to connect, basically, is what's going to happen. So your superior and your inferior are going to connect with each other, and they're going to insert into the hyoid bone. So they're going to run from the scapula to the hyoid bone. So you can see it's kind of a long one that comes right up here. Your sternothyroid function is to depress the thyroid cartilage and larynx. Again, they help in swallowing. Its origin is the sternum, and its insertion is the thyroid cartilage. And it's innervated by the second and third nerves. We're not going to worry about that right now. And then your sternohyoid depresses the hyoid bone. So you can see how we've got thyroid and hyoid. Thyroids are going to insert into the thyroid cartilage, hyoid into the hyoid bone. So that gives you kind of some idea of where they're going. Again, you're going to come up with a mnemonic to remember this and look at these pictures. Your muscles of your tongue, their function is for mastication, speaking, and swallowing. So think about all of what your tongue does. It helps you when you're chewing. It moves the food around your mouth. It aids in speaking. It moves up to the roof of your mouth to help form letters or pushes against the lingual surfaces of your teeth to help sound. And it aids in swallowing, so it kind of lifts and pushes the food back from your mouth to your throat. You have intrinsic and extrinsic. Intrinsic are muscles that are actually inside the tongue. Extrinsic are muscles that attach to the outer surface of the tongue. The intrinsic muscles help to do things like roll the corners of your tongue. Everybody roll the corners of your tongue. Those are your intrinsic muscles. Your extrinsics are what allows you to stick your tongue out, pull it back in. Your intrinsic tongue muscles function to change the shape of the tongue. So they're what causes you to curl your tongue. They're inside or intrinsic. And they're named by their direction or orientation. We don't spend a lot of time learning these, but do be aware they're all named kind of after their shape or orientation. So superior longitudinal are going to lay longitudinal, and they're going to be above or superior. Then you've got your transverse, which run in a transverse direction. I think somebody's trying to get back in the meeting. Hold on a second. Nope, you're all here. It must be the. Then your vertical are going to run in a vertical direction, and your inferior longitudinal are going to be down inferior. So you can kind of see on this top picture here how these little striations run horizontally or transversely, and then you've got your vertical that are going to run this way. Okay, extrinsic muscles. These are the ones we really want to pay attention to. You've got your genioglossus, your styloglossus, and your hyoglossus. They are responsible for movement, sticking out your tongue, pulling it back in, moving it side to side. They are located on the outside of the body of your tongue, and they insert into either the mandible, the styloid process, or the hyoid. So they kind of give you a little bit of hint in their name. The genioglossus is going to insert into the genial tubercles. The styloglossus is going to insert into the styloid process, and the hyoglossus into the hyoid. I'm scrolling the wrong way. The pharynx or pharyngeal muscles are divided into the nasopharynx, which is the nose area, the oropharynx, which is the mouth area, and the laryngopharynx, which is the throat area. So NOL. But those are easy to remember because naso is going to be toward the nose or toward the top. Oro is going to be toward the mouth, and laryngo is going to be toward the larynx or the throat. They're involved in speaking, swallowing, and middle ear function. So the muscles of the pharynx include the stylopharyngeus muscle, the pharyngeal constrictors, and the muscles of the soft palate. And those are the muscles right there. And here are some pictures of them. And so you can kind of see this is the neck area. This picture right here is like a blow up of this area right here. And it's rotated around so you can see, it's like if we were looking at the back of your head. The muscles of the soft palate. So your soft palate also aids in swallowing. It elevates and depresses the arches in the back of your throat that we talked about, those palatal arches. And so they help to move the food back. Your tongue kind of pushes it back. Your arches constrict in and out to push it back, and they work the food down your throat. And there's 4 of those, sorry. Here's the 4 muscles right here. And that's it. So as far as the muscles go, the PowerPoint was short. If you go into your Canvas and look at, there's a table or a chart that I've listed the muscle group, all of the muscles that fall within that group, and then the information about them, their origin, their insertion, that kind of thing. There's also a little handout where you can fill in the names or the part that's missing. I might ask you what's its function or what's its origin. Work on filling that out. The best way to do it is come up with some mnemonics, but also look at their names. If you think that you can figure out where they are or what they do just by looking at their name, don't spend a lot of time making cards and all that kind of stuff for the stuff you already know. When you, some of you are creating these Quizlets. Quizlet is really good for this because you can just keep going through question after question about it. So do definitely study these. When you're taking your midterm, we don't have a quiz on this, so keep that in mind. When you're taking your midterm, you won't have notes available. So that chart won't be available to you to look at when you're taking your quiz. Anybody have any questions on this? It seems like it's a lot of information, but when you start studying it and you relax and you take a deep breath and say, okay, I can do this. When you do that and you start, like I said, just repeating the words, it's going to start to make sense that you don't have to memorize a whole bunch of it. You can figure it out just by breaking down the words.
I have a question.
Okay.
Your assignment board, it says for the identification answer form, when I click it, it doesn't, it says something's wrong, or I don't know if it's in there, but yeah, I was just curious about that.
The assignment 4?
Yeah, like the answer sheet or answer form that we need to fill out.
Well, it's probably not open yet because I don't think it's supposed to open until after class.
Oh, okay. Yeah,
So
the PowerPoint was able to open, or the muscular system ID page. I just like started looking at it and.
Oh, let me look at it when we get done then, and I'll make sure that you can access it.
Okay.
There's probably just some little button I didn't click on it or something. It's very sensitive. Okay, so we also need to go through the TMJ today, which is chapter 5. So let's go ahead and look at that. Uh-oh. It's not giving me the PowerPoint for chapter 5. Well, let's see what we've got here. Okay, that's not. Okay, so the PowerPoint for chapter 5 is a little bit long. I'm going to go through it pretty quickly because a lot of it you just don't, you can just kind of read, and some of the TMJ stuff, I don't know why it's not coming up. Some of the TMJ stuff, you probably just need to kind of look at it and work on it as far as Just reading it'll tell you what you need to know. There's only a few things we really need to know right now. Where are the points? All right, let me see if I can get this open here.